expected to know the things of a postgraduate trainee. It's not a specialty exam. But I think what makes it difficult is the finances associated with it, because it gives you stress. And secondly, in current COVID situation, getting a PLAB to date and a visa is not an easy thing. So that adds to the stress of the people, and it affects their preparation as well. But if we will just talk about the exam itself, it's not that difficult. It's not that difficult because many people can pass with proper preparation and practice. All you need to know is that you should have the orientation of the exam, what they want to know from you. Okay. So the learning objectives of this session are, the first of all, I will be telling you what are the total number of stations, what is the passing criteria, what types of station can be given to you in the exam, how to manage your time in the station. That's really a key point. And understanding your results. By that, I mean that in what domains they want to assess you, what are the areas of the clinical consultation they are checking in you if you are a good doctor or not. Okay, so we will explain that to you in the form of a result card sheet. Next, we'll be giving you some type of scenarios and we will discuss them briefly, that what type of station it is. Okay, we will first of all tell you what are different sort of stations asked in the exam, and then we will give you some examples and we will discuss that. And at the end, we will do a mock station in which one of me and Dr. Arooj will be simulating as a patient and other one as a doctor. Okay. Next. So first of all, there are total 18 stations in the exam. 2 are the rest stations. Kindly please mute your mic.
Dr. Adnan, we are not able to hear you.
Hello. Hello,
Yes,
hello,
we
hello.
can hear you now.
Okay, so I was telling that there are total 18 stations in the exam, and 2 of them are the rest stations, and rest of the 16 are the observe station in which you will have to perform something. Okay, so everyone has to rotate from those 18 stations, including the rest stations. The next thing is, what is the criteria to pass the exam? Okay, what is the minimum passing score? What is the minimum number of stations you need to pass? So out of those actual 16 stations, you need to pass the 10 stations minimum. If you pass the 9, you fail the exam. And it's not only the number of stations which you need to pass, there is also a total score which you need to achieve. That score varies from day to day. It's variable from day to day. And generally it's between 100 to 110. And you also need to take that minimum score of total to pass that exam. For example, let's say an exam is conducted today and the minimum passing score, the total score is 104. So a candidate is expected to pass a minimum of 10 stations and his total marks should be 104 or more than that. If he has passed 9 stations, but he has got 110 marks, he still fails the exam. And let's say if he has passed 100, if he has passed the 12 stations, but his marks are 103 or 102, he still fails the exam. So both of criteria should be met to pass the exam. Okay. You can't hear. Okay, so am I audible now?
Yes, we can hear you.
Okay, thank you. Okay, next thing, what type of stations can be given in the exam? There are different sort of stations which you are expected to know. The first one and the simple one is a history-based scenario. It can be from any subject, any field, like it can be from medicine, ped, surgery, ENT, eye, or gynae and obs. Just to give a brief overview, what is a history-based station? In this scenario, you will be given a description outside the cubicle that a patient has came to you and he has some complaint. So you are expected to take the detailed history, reach a diagnosis, and tell the diagnosis to the patient and do the management. The next type of station is the examination only station. In the examination only station, you don't need to take the history. All you need to do is to do the examination. For example, the description given outside the cubicle is that you have to, it's not essentially an examination. It can be some skill, like you might be expected to pass a Foley's catheter. That's also included in this sort of station. So it can be an examination on a mannequin, or it can be a skill like IV cannulation, IV sampling, or examination of some dummy like chest examination, abdominal examination. So next one is a combined station. In the history-based station, you don't need to do the examination, okay? You will be just taking the history. You will verbalize that based on this history, I would like to do this and this examination. For example, if a patient has came with the chest pain, you will take the history of the chest pain. And after taking the detailed history, you will just verbalize that I would like to check the vitals and I would like to do the examination of the chest. You won't be expected to do the examination because the examination findings will be given to you by the simulator, by the patient. They will hand over a sheet to you on which there will be examination findings written over there. So how combined station is different from the history-based station is that in the combined station, you will be given a task, take the history, do the relevant examination, and then discuss the diagnosis and management. So in the combined station, you'll have to take the history, actually need to do the examination, and then go to the management part, okay? We will further discuss those stations in the detail in the upcoming sessions as well. It's just an introductory session, so let's not complicate it. So next one is the counseling based. In a counseling based station, most of the time you're already given a diagnosis. And all you need to do is just take a brief history to relate his current situation, okay, with his illness or medical condition, and then counsel him accordingly. It can be counseling regarding a medication or lifestyle advices or anything. But in this, history is not a major part. In ethical scenarios, you might be given a situation, ethical situation like breaking a bad news or an angry patient or someone who's complaining. So you just need to spend a little bit time on the history taking, and the rest of the part is for uh, addressing the ethical concerns. Okay. Psychiatry stations. Uh, in psychiatry stations, you are given uh, acute psychiatric illness most of the time, like a patient who has came with the psychosis or a patient who has came with the suicidal tendency. So you will have to deal that accordingly. Um, we will go into the detail of it when we'll be discussing the psychiatry stations, particularly specifically in the future. In the teaching based station, one is expected to teach some basic clinical examination, or let's say ECG, to a junior doctor or a final year or fourth year medical student or a nursing student. So in this station, you will be clearly given a description outside the cubicle that you will have to teach this thing to a nurse or a junior doctor. Okay, so you have to spend all the 8 minutes in teaching session. You don't need to take the history in that. So the next one is a sim man based station. A mannequin is like a dummy. Let's say if you are supposed to do the examination of the abdomen, the dummy can be just only of the abdomen. But a sim man is a different thing. Sim man is a like whole android human being which can speak and which can give some examination findings as well. So in Simman based station, mostly they put such sort of scenarios in which you'll have to deal with the acute medical condition. Okay, because to mimic that acute medical condition, they have a monitor over there, and the same man can give you the actual physical finding as well. Okay. And the most important one is the telephonic station. It's not different from the rest of the stations. It's not something new. As there is COVID and they want to minimize your contact with anyone, minimize your interaction with any person. So they are taking the social distancing measures. If you need to ask anything, kindly please you can just comment, and we can have a question answer session at the end as well. Thank you. Okay, so in telephonic stations, it can be from a history based, it can be from a counseling or an ethical situation. Obviously, it cannot be a teaching based scenario because they don't expect you to teach something on the phone. So nowadays, 5 or 6 stations are from the telephonic consultations. The telephonic consultations are not something new. Previously, those stations, which were in-person stations, and nowadays they have slightly modified them, converted them into the telephonic consultation. Okay, we'll go into the detail of that what changes you need to make it telephonic consultation. Okay, next. What is the time frame of the exam? As I told you that there are total 16 actual stations in which you'll have to perform, and there are 8 minutes for each station. That means you will spend 8 minutes in the cubicle while taking the history if you need to do the examination and the management part. Okay, and we will further go into the detail that depending upon the type of station, how you need to divide your time for the history and the management part. We'll go into detail of that next. And the second thing is the 90 seconds are given in between the stations. In between the station means, let's say after completing the station number 1, you are supposed to move to the station number 2. So when the 8 minutes bell ring at the station number 1, you move out, go to the next station, and there will be description of the station number 2 outside. And you have those 90 seconds to come out of the station number 1, go to the next station, read that description, make up your mind what you are going to do in the next station. So 90 seconds are given for you for that. Okay. Next, we'll go into the detail of like what are the components of the station. The first one is the data gathering. Data gathering includes 2 things, history and the examination. When a patient comes to you with a complaint, you want to seek the information from the patient. Like you'll take the history, you'll do the examination, you'll get the positive findings, and then make a diagnosis, disclose the diagnosis to the patient, and do the management of the of that diagnosis or the condition. And so the first part is data gathering. The next one is the diagnosis and management. And last but not least, I think the most important part is the interpersonal skills. Interpersonal skills, by that, what they expect from you is that you are a polite doctor. You show empathy and sympathy to the patient. You are understanding his situation, not just the medical situation, the psychosocial impact caused by that illness. Okay, so interpersonal skill is the most important part, I think. That is because many people struggle with the interpersonal skills. By just memorizing the type of station, you can memorize that what history you need to take in the back pain station, what history you need to take in the chest pain station. But interpersonal skills are something which comes with the practice. Okay, it's not a difficult thing, but I'm just emphasizing that it's an important area which you need to improve. Okay, and history and the interpersonal skills start from when you enter the cubicle and start taking the history, and it ends with the management. They are throughout your consultation. We'll go into the detail of that when we'll be studying some specific patients. Okay, there are generally 3 domains on which you are assessed. As I previously told you, each station carries a total 12 marks. So they have distributed those 12 marks into these 3 domains. 4 marks are for the data gathering, that includes the history and examination. 4 marks are for the clinical management skills, the diagnosis and the management. And equally 4 marks are given to the interpersonal skills. That means if you take a really good history, do a really good examination, but if you don't have good interpersonal skills, it's gonna decrease your score. So you will have to be an all-rounder to pass the station. Okay, so this is a sample. Can you please mute the mic? Okay, thank you. So this is a sample of a result card. Okay, uh, uh, let's give into a brief detail of it. If you look at the station number 1, in the data gathering part, the score given are 3. In the clinical management, the score given is 2, and in the interpersonal scale, it's 3. And the total score one has got out of the station is the 8. And the next thing written is the pass score needed. What was the minimum score required to pass that particular station? That was 5.4. So as a candidate has got more than that, so he's passed. And just look at the station number 2. The total score got is the 4, and the required score to pass that station was 5.43. So it's a fail. As I previously told you, that there is a total of a total score which you need to achieve, just like over here down 120, it is a total score, and 107 was the required pass score. And there is a separate passing score for each and every station. Like it's not 6 out of 12 for all, it's not 8 out of 12 for all. That depends upon it's actually a relative marking. If all the people have performed really well, so the passing score can be a bit higher. And if all the people have not performed well in that particular station, score can be a little bit low. So it's a relative marking. Okay, generally the passing score is between 5 to 7. You're not supposed to take 11 out of 12 to pass the station, or 10 out of 12 to pass the station. It's really good if you get maximum score, because that will add to your total, and that will give you a edge if you even if you pass even if you fail a few station with the really bad marks, that will compensate for that. That means if you fail a station, fail with a less margin. If you pass a station, try to get more marks. Okay. Apparently, it seems that there are only 3 things which they want to know from you: is the data gathering and the clinical management, diagnosis and management, and the interpersonal skills. But if you will go into the detail of what they want to know from you, there are actually 10 domains on which they assess you. So when the result is declared, there are 2 sheets. The first one which we have discussed, and next one is this sheet. So they give you marks and they score you on all these domains. What they want to know from you, what they expect from you, that how you perform in a particular station, is all these domains. Okay, so this will be explained to you by Dr. Aruj. She will explain all these domains to you, and then I will continue the session.
Thank you, Dr. Adnan. Good afternoon, everyone, and thank you again for joining. So, as Dr. Adnan explained, that other than the 3 main domains that he has already explained, they do go into the details of these 10, let's say, qualitative feedbacks as well. So, in case you have not performed well in a particular station, you can always go back to your scorecard and have a look where or what were they more expecting from you. Now, these tick marks might seem that this is something good that you've done, but the more tick marks you have, it means the worse you've performed, or the more bad you've performed in that particular station. So let's begin from the first one, the consultation. Now, this consultation means that from the beginning, starting from the history taking, how you have performed in a particular station. So, for example, let's count the history taking. So, if you started with the history taking, you just asked the patient about maybe about his symptoms, for example, chest pain. Then suddenly you moved on to the past medical history, and again you came back, maybe asking something else about chest pain or some related symptoms. It will look very disorganized. This is what they want to see, that if you have practiced well, you do know what questions to ask where, or you will have a proper approach. Similarly, it applies to the management as well. You start with the management and you have to go in a particular order because you're an FY2. If you don't go through that order and you just skip from here or there, or you tell them first what the specialist is going to do, but you don't manage the pain that the person comes with, they're going to mark you down on the consultation. Next comes the diagnosis. Now, sometimes there Sometimes there are new stations, or sometimes there is a time when you don't know about what the diagnosis is. If you don't know the diagnosis, that is completely fine to tell the patient or the simulator that I am sorry, I do not know what this is, but I'm going to do this. I'll be consulting my seniors. That is completely fine than giving them the wrong diagnosis. This is when they mark you down on the diagnosis. The third one is the examination. So, for example, if the scenario outside says that you were supposed to examine and you forgot, you did not examine, and you just verbalized and proceeded on, they will not remind you that. They will be marking you down on the examination. Or if you have done the examination but you've not conducted it properly, they will be marking you down on this. Or in other when you have to verbalize examination, just verbalize and you didn't. That is also when you're going to be marked down on the examination. The fourth one is the findings. These are very important. These can be verbal cues, non-verbal cues, or in the form of a sheet with you. So if the person, for example, tells you that he comes with a certain illness, certain problem, but he tells you that I am really suffering with my job, he gave you a verbal cue and you did not address that, or you did not pick that finding, you will be marked on down on that. Or if a patient is in front of you and he's very restless, you can see he's very anxious, looking outside the window, and you did not address that. Again, this is a non-verbal cue that you did not address. And thirdly, if let's say a set of labs has been given to you and you did not explain those to the patient, you directly jumped on the diagnosis or on the management. Again, you did not address the findings, so you will be marked down on it. Now, issues. Issues means here the concerns that the patient discusses with you, or the patient tells you from the beginning. From the beginning, sometimes the patient might not tell you that I have back pain. Sometimes, like in consultation, the patient might tell you, Doctor, I'm worried about stroke. So you do start asking the questions, but then in the management, have you answered that is this a stroke or not? Or do you think it is likely to be a stroke? This is very important to address the concerns of the patients. If you have knowledge about a certain topic, for example, meningitis or anything, and you do tell them all the information that you have, but you did not address the particular issue that the patient had, you will be marked down on it. Next comes the language. So the by language, they already know that you have passed the necessary English examinations, so they do know that you have the proper English language. But still, the fluency matters a lot. Along with that, the terms that you use matter a lot. So if you tell the patient directly, you have meningitis and we are going to admit you, this is not going to work. You have to tell them the proper diagnosis in the medical term, and then at the same time, you have to simplify it for them what meningitis is. And it, okay, guys, please, I would request you to mute your mics. Thank you. So, yeah, so not only in the diagnosis, but also in the symptoms. If you ask the patient, have you had any palpitations or have you had any hematuria? Of course, they're not going to understand that. So, making it simpler for the layman person to understand, this also counts in the language. The next and the most important part is the listening. Listening not only means that you have to not interrupt the patient when he's talking or telling you about something, but that also means that not asking the patient again what he just told you. So, for example, if the person tells me that I had this pain for the last 2 months, and after two questions I ask him again, can you please tell me for how long have you had this pain? They will mark you down on listening. It means you were not paying enough attention to what the patient was saying. If you forget, that is completely fine. You can excuse and ask them again. I'm really sorry, I just forgot what you said, or I'm really sorry, I did not understand what you said. But do not ask the same question again. And if the person is telling you a long story about anything, that is a part of the task. They speak nothing extra there. They know that you have to manage your time. So don't worry about the time then. Let them speak, listen to them. Next is the management. Again, as I mentioned earlier, the management as an FY2 has certain points that you need to cover. As an FY2, if you tell the patient that we will be referring you to the specialist and the specialist will be doing this, instead of just giving them the acute relief at the moment, you will be marked down on that. If the patient, for example, a pediatric patient comes to you and the patient has had, let's say, otitis media, but is not feeding well. You see the patient is dehydrated, or the findings have been given to you, the blood pressure is low, and or maybe the mucous membranes are dry. You know that the patient is dehydrated, is not feeding well, has been dry, sorry, and you do not admit the patient. You will be marked down because as an FY2, you cannot discharge this kind of patient. However, we'll be going into the details again, so you'll be having a better understanding of what I'm talking about. Then comes the repo. The repo building is not only with the patient, but it could also be with your colleagues. So any person you come across, or maybe it could be a patient, it could be your colleague, it is very important to greet them in a nice way, in a professional way. That will how it will help them cooperate with you and open up to you. There are different ways to deal with both, and we will be discussing those also in the later sessions. The last and the most crucial thing here is the time management. Now, most of us might think that time management is going to be difficult or it's different there. Yes, definitely it is different there. It's not exactly same how we practice here, but practicing makes you so perfect that you, without seeing the timer, you know that now I'm over 5 minutes or I'm over 6 minutes and I should stop taking my history or I should continue with my management. So, time management can only be uh, managed with the practice, with continuous practice. And with this, I think that the areas of assessment we've discussed about are finished. I'll be handing over to Dr. Adnan again, but I would request you all to join the meeting again because it's less than 5 minutes left and we will be starting the same link again. So please disconnect this one and join again.